Hey everyone, Kristen here at ZFO. Just want to take you through our instruction sheet for our palatal expanders, just in case anyone has forgotten anything about it or needed a refresher. We do have a section that talks about how the turns will be done, so it's always one turn at a time, every other night, and once doctor views the patient, he will say for how many days and the total of turns that would be completed. We also have a tracker here, so as you make those turns, you can mark them off so you know exactly where you're at for the tracking. Some things to expect with the expanders: it will be in for a total of 9 to 10 months. Now, when making the turns, those will happen and get finished within a few weeks or the first month or two, but then the additional months is for everything to stabilize, because if we take it out too soon, everything will go back to where it came from. It is also common to have pressure on the teeth and the roof of the mouth due to the expansion, but very mild. Temporary sores on the cheeks and tongue. Sometimes you will see little indentations from where it is placed. Also temporary changes in speech, because it is in the roof of the mouth, so there may be a little slur here and there, but the more that the patient talks, the speech will go back to normal. Also common, a little extra saliva, so the patient may be a little slurpy for a day or two. Also a change in how the bite feels. So remember, as we widen and expand that palate, it is common for the bite to feel different from time to time. Also, food getting caught around the expander. I always like to recommend just eating through the whole meal first, and then once you're done eating the meal, then go ahead and brush and clean out anything that is still stuck around it. Also, a possible temporary space between the upper front teeth. So as we widen that upper palate, if you notice the two front teeth starting to space apart, do not be alarmed. That is all part of the process, and those teeth will naturally go back together as well. We also have some care tips to help you get through the first few days. Soft diet is always recommended, just getting used to eating with it in. So anything like hot dog, hamburger, pastas, just things that don't take a lot of effort to chew. Also avoiding anything hard, sticky, and chewy. So we want to make sure that we're staying away from anything like gum, Laffy Taffies, Tootsie Rolls, Starburst, anything within that sticky, chewy category. When cleaning, you want to be sure to brush all around the expander. So taking that toothbrush, brushing really good all around the roof of the mouth there. A couple precautions also listed. Only turn the number of times prescribed by Dr. Zach. So if he recommends 10 turns, do not go past those 10 turns until we see the patient again, because that next appointment, we will be able to see how much expansion has taken place. And at that time, doctor will let you know if any more turns may be needed. Always be ensured to work carefully with the expander key in the mouth, which is why we always do the first one in the office to make sure all parents and patients are comfortable before going home. If the expander does happen to come loose for any reason, please stop turning. Do not make any additional turns until the patient is seen by Dr. Zach, so that we can get the expander secured back in place. If the patient does mention any type of discomfort, it is okay to give them any type of headache medicine like Tylenol, ibuprofen if needed.